So now we're going to talk about the treatment using ultrasound, and what you need to consider before you're treating is the depth of the lesion that you're treating. If it's a fairly superficial lesion, i.e. up to 2 centimeters depth, then you can use the 3 megahertz transducer. If it's a deeper lesion, i.e. you're wanting to get to about 4 centimeters depth, then you would use the 1 megahertz transducer. So we're going to assume here that we've got a superficial lesion of the wrist extensors. The second thing you need to consider is whether the lesion is acute or chronic. If it's more acute, then you're going to use pulse or duty cycles rather than continuous treatment for this patient. The third thing that you need to consider is the size of the lesion, and that will help dictate how long you're going to give the treatment for. And the best indicator of treatment time is that you give 1 minute per area of the treatment head. So for instance, if we say that the lesion that we've got here in the wrist extensors is superficial, so I'm going to use my 3 megahertz transducer. It's about 5 centimeters squared in size, so I've got a 5 centimeters squared head on my transducer, so therefore I'm going to do 1 minute treatment, and it's acute, so therefore I'm going to use pulses or duty cycles. Prior to doing the ultrasound, you need to make sure that you have your patient's consent, you've checked that they have no contraindications. You're then going to apply your coupling medium to either the transducer head or the patient, whichever you want. So I'm going to apply it to my patient here, so putting the gel onto the area that I want to treat, making sure that I've got enough to act as a coupling medium. I'm then going to pop the transducer head onto the gel, and then I'm going to set my parameters. So I've got 3 megahertz and I've got it pulsed, and then I'm going to turn it to a treatment time of 1 minute and turn up the intensity to about 0.3 of a watt per centimeter squared for an acute lesion. And then what you need to do while you're doing the treatment is make sure that you're continuously moving the head to avoid a standing wave forming. So you carry on moving the head around the area that you're treating until your buzzer goes off with the treatment time. Once you've done the 1 minute's treatment, the buzzer will go, so that's it now, because the light has come on saying that there's no more intensity coming out of the machine. You turn all the dials off, you remove the transducer head from the patient, and you switch the machine off.